Welcome to our video about treatments for fingernail fungus. Treatment for fingernail fungus. Treatment for fingernail fungus may be difficult. There are several methods available. Topical, laser, oregano oil treatments, and oral medications are available. Let's examine each one briefly. Ultimately, you will decide which method works best for you. If you've tried several treatments without success, you may want to try one of these. If you're not sure which one to try, read on to learn about the best way to get rid of fingernail fungus for good. Oral treatment. One of the most common treatments for a fungal nail infection is an oral treatment. These medications are more effective than topical treatments and are generally longer lasting. These drugs can clear the infection in 6 to 12 weeks and allow a new, healthy nail to grow over the old one. However, you should be aware that these medications can have some side effects, so it's important to talk with your doctor about the right medicine for you. Fluconazole is an oral treatment for fungal nail infections. It's expensive, and some insurance companies balk at paying for a cosmetic treatment. Fluconazole is a generic drug available without a prescription. Fluconazole is the most common option. Fluconazole is available for approximately $25 a month. Fluconazole is a good option if you don't have a previous history of the disease or have diabetes. It works by reducing the amount of fungus in the nail. Oral treatment is not effective on its own. It may take a year or more to completely cure your fungal nail infection. But you can save yourself a lot of time and money by choosing an online treatment option for fingernail fungus at QuickMD. You can get an appointment online, pay online, and avoid any hassles with insurance. But remember, these articles are only for educational purposes and should not be relied upon for medical advice. Always contact a medical professional if you're experiencing a medical emergency. A common form of the disease is called paronychia. This is an infection of the skin around the nail caused by a yeast called Candida. People with chronic paronychia may have the same condition because their skin becomes inflamed over time, making the cuticle vulnerable to yeast. Antibiotics may be necessary to treat a severe case. The first step in therapy is to keep the nail dry and clean. A fungus treatment is not always effective and can have negative side effects. Fluconazole, another common treatment for fingernail fungus, is another option. This antifungal medication is not approved by the FDA, and in head-to-head comparisons, fluconazole does not perform as well. It's expensive, needs to be taken once a week, and can cause severe side effects such as burning and redness at the application site. It may also exacerbate the symptoms of the athlete's foot and other forms of fungus. Laser treatment. Laser treatment for fingernail fungus is performed by a healthcare provider. This provider may be a podiatrist, family doctor, or dermatologist. The first step is debridement, which involves clipping the toenails and cleaning dead skin. Before laser therapy is administered, the foot will be cleaned with a sterile solution. The foot will be placed in a comfortable position. Then, the healthcare provider will apply the laser over the affected nails and over the nail beds that are not infected. Laser treatments are much safer and more effective than topical creams or oral medications. Many patients can be cleared of their infection after 3 or 4 laser treatments. Patients should comply with all treatment instructions, including regular doctor visits, the use of medicated nail cream, spraying shoes to remove fungus, and avoiding public areas while under treatment. In addition, they should avoid wearing nail polish while on the treatment. In addition, laser treatments do not cause liver damage and are much more effective than topical medications. The only major drawback of laser treatment for fingernail fungus is the long time it takes for nails to regrow. The majority of studies do not provide long-term follow-up results, and one study found that relapses were common. However, laser treatment for fingernail fungus can inhibit fungal growth while killing some microorganisms. This treatment is likely to be successful only if the patient's symptoms disappear completely and there is no evidence of fungal growth in the nail culture. There are also significant benefits to laser therapy for fingernail fungus. For example, laser treatment for fingernail fungus has been found to significantly increase clearance rates in patients with confirmed trichophyton rubrum infection. The procedure is safe for most people, and a minimum fluence of 7x1031 photons M2S1 has been reported to be effective in treating nail fungus. Laser treatment for fingernail fungus usually takes between 3 and 4 sessions. Each treatment session is spaced about 5 to 6 weeks apart for optimal results. A new nail will grow in 6 to 12 months, while the old one will take 9 to 12 months to replace. Unlike oral antifungal medications, laser treatment for fingernail fungus will not damage the existing nail. The laser treatment does not remove existing nail polish, but it will remove the fungus from the affected nail. Oregano oil treatment. If you want to cure your fungus infection naturally, you should use a remedy with oregano oil. It is effective in treating toenail fungus. You can apply the oil twice a day on infected toenails. You should avoid using the same nail tools that you used on your uninfected toenails. Wear 100% cotton socks when you're infected. Change to dry socks when your feet get wet. Also, make sure to wear comfortable shoes with wide toe boxes. The main ingredient in oregano oil is carvacrol, which eliminates 3 types of fungus and 6 types of bacteria. However, it may not work on every kind of fungus. This is because the oil is strong and may cause irritation. It is advisable to dilute it before using it on your fingernails. This treatment can cure fingernail fungus and can be done for any other problems as well. You can apply oregano oil to the affected fingernails or scaly skin. However, be sure to dilute it first. This oil can cause rashes and burns on the skin. It should not be used by people with sensitive skin or those with diabetes or gout. You should also avoid using it if you have an allergy to oregano oil. And remember, don't apply it in excessive amounts, because it can affect your digestion and cause bleeding. Oregano oil can be applied topically to the affected area. You can mix 1 part of oregano oil with 1 part of carrier oil and apply it to the affected area. Leave it on for at least 15 minutes. Repeat this procedure a few times a day. It can also be used in a foot soak with vinegar. But remember to wear socks while using this treatment to avoid spreading the infection to other parts of your body. The oil is an effective remedy for toenail fungus. But before using oregano oil, you should make sure that you do it in a controlled environment. Your doctor will monitor you closely during the procedure and guide you accordingly. The treatment should be continued for a week or so to prevent the regrowth of the diseased fingernails. If the symptoms are severe, you should use a special nail polish that contains oregano oil. Topical treatment. If you have a fungal infection in your fingernails, you may be thinking about getting a topical treatment. While you might think snake root extract will eat away your nails, it actually has very limited effects. The same is true of tea tree oil and vinegar, which are also popular options. Unfortunately, topical medicines don't penetrate the nail unit very well, and are therefore limited in their effectiveness. Fortunately, there are a few treatments that can provide long-lasting relief. Firstly, a nail culture is required to identify which fungus is causing the infection. The doctor will take a sample of the nail and send it to a laboratory. A report is usually returned within a week. In addition to fungi, yeast and bacteria can also cause the infection. Knowing the exact cause of the infection will help your doctor determine the best treatment. If you notice yellow, discolored, or brittle nails, you should see a doctor immediately. While the majority of these topical treatments don't cure nail fungus, they do improve the condition of your nails. But, despite the promise of a cure, a cycle of cyclopyrox is unlikely to completely eliminate the fungus. To achieve the desired result, you should continue using the treatment as recommended and never stop using it without consulting your doctor. Ideally, you should cut your fingernails on a regular basis to ensure the best treatment results. Some people who have onychomycosis may be able to find relief from Lamisil, terbinafine, cream, which costs $12 for a 0.46 ounce tube. Although this cream doesn't work as a solution for the fungus in more advanced cases, it is still worth a try if you're looking for an inexpensive, topical cure for the problem. One of the most effective treatments is a combination of topical antifungal drugs. However, if topical treatment is not effective, you should consult with your doctor to determine a suitable medication. Various antifungal medications are available and they all target different types of fungi. The topical treatment for fingernail fungus is the most popular treatment because it is the easiest and fastest solution. Thank you for watching. Please like, comment, and subscribe if this was helpful.